And we just want to go over some of your bills, either you sponsor or you're co-sponsored. And
Mhm.
but one of the, I guess, what probably makes you a different state senator is that your background with the social worker, and you are a trauma social worker and a case manager, and this, I'm sure, is giving you a unique perspective on issues and healthcare policies. So, how has that influenced you legislatively, priorities, and particularly in healthcare? How did that help you?
Absolutely. So thank you so much for that question. And yes, I spent 6 years working at Christiana Care as a case manager, social worker, and 3 of those years were spent in the ICU at the hospital, the surgical ICU, or sometimes we called it the trauma ICU. And it was an eye-opening experience being there. You know, a lot of times when people think about the hospital, they think only about the medical needs that a person has, and the medical barriers that a person faces. But as a social worker, I also really worked with and helped to try to work around the other barriers that impact a person's medical improvements or their long-term medical outcomes. So the access that a person has to insurance, the access that a person has to a primary care doctor, their ability to get back and forth from to and from appointments, their access to healthy foods, all of these things would become either barriers or strength to a person's long-term medical outcomes. And so the work that I did as a social worker is absolutely why I decided to run for office.